Hello, so this is Dr. Anindya Mukherjee. I am an interventional cardiologist. I work in Kolkata, in India. So we are talking about the latest update in hypertension, which is a much discussed topic amongst doctors. But today I am talking for my general population, that is my patients, and also the larger audience out there who are not doctors themselves. So by latest update, what we want to share to patients is that the huge load that we have, that is the raised blood pressure, is among the most important risk factors for cardiovascular diseases, as we all know. And many of our patients are hypertensives. And most of the patients, the bulk of patients we cardiologists see, have some high pressure problem or the other, and related organ damages as well. So it remains very poorly controlled due to the low awareness about hypertension still, which is prevalent in India, lack of appropriate care through primary care, poor follow-up of the patients. When the patient's blood pressure is controlled, sometimes they don't come to follow-up. So the first point that I want to share is the prevalence, that is the number of patients of hypertension we have been seeing has gone up very high in the last 30 years. So it has gone quite high up, say for 38% in men and 32% in women. It has gone up to around 50% in men and 41% in women. And most of them are unaware that they are having hypertension. And nearly the 50% of the patients who are aware are not taking medications. So this is really worrisome. So what the message I want to give is, if you are not sure whether you are having high blood pressure, please go to your doctor, get it checked. And if you are having high blood pressure, please consult your doctor so that you are taking the proper medicines or the proper lifestyle measures your doctor say. Another important point is a new guidance, that is now we know that we want the blood pressure to be less than around 130/80. So if among the low risk, that is we have grade hypertension into type 1, type 2, type 3, type 4, we don't want to elaborate the details for everybody. It's a bit cumbersome and it's a bit difficult for general people. But the important thing is, if you're having a blood pressure in 130 to 139, the upper range, that is systolic blood pressure, and 80 to 89, the lower blood pressure, that is a diastolic one. So the management is primarily non-pharmacological. That is, you need not take medicines. You need to change your lifestyle measures. You need to exercise. You need to have salt restriction. And there are some diets, which is like one is called a DASH diet, you can find over the internet, which are used to reduce high blood pressure. So all these are usually helpful. And we see it for 3 to 6 months. Usually most of the patient's blood pressure come into under control. If this is still not under control, then you need to take medicines. But I will advise my patients that please adhere to lifestyle modifications if you have your blood pressure in this range, and definitely your blood pressure is very likely to improve. Another important thing is, recently the blood pressure targets have come a lot down. There have been some studies which have shown that previously we wanted it to be less than 130/80 and we were fine. Many of my patients ask that whether I am having a blood pressure of 100/60, doctor. So I don't have any problem, but isn't it too low? Well, it's not too low if you are not having any problem. Yes, if you are having some dizziness, reeling of it, then it's a problem. But otherwise, yes, now the recent studies show that it's lesser the better. It's around, if it's around 110, it's fine. The upper blood pressure, that is less than 130, less than 110, okay, it's fine. The lower blood pressure less than 70, it's fine. But of course, we don't want it to be less than 90/60. Then the chances of other problems rises. So around 110/70 is fine if you are having your pressure. And for that, we like to reduce the blood pressure to less than 130/80 and even lesser down to 110/70 or something like that. That is only helpful for our patients. And another important point is ambulatory blood pressure monitoring and home blood pressure monitoring. Patients frequently ask whether I should measure blood pressure at my home and what is ambulatory blood pressure monitoring, doctor. So these are very important. Recent studies have shown that only measuring a blood pressure in a doctor's chamber is not always helpful. So we want to measure blood pressure when you are at your home as well. And when you get back home and you measure home blood pressures, many frequently it happens that you had a white coat hypertension, that is, you had a high blood pressure in the doctor's clinic, but now it's fine. On the contrary, the other thing can also happen, that you are having a low blood pressure in a doctor's clinic, but you are having a high pressure at your home, which is called masked hypertension. The causes are manifold. We are not discussing those right now. But yes, blood pressure monitoring at home and ambulatory blood pressure monitoring is important. Please consult your doctor. He is the best to judge which one you need or at all you need or not. Coming to the next point is combination therapies. We are often asked that whether we should take combination therapies as pills. Some doctor has given me 3 molecules in one tablet, whether it's useful. Well, it's very useful because the recent guidelines say it's better to give 2 molecules together, because in that way we target 2 mechanisms by which your blood pressure is being raised. So simultaneously, we call it multi-pronged approach, or we call it a forked approach. That is, we are approaching it through different approaches. So there is one enemy, we are approaching through 2 different approaches so that it can't escape via any of them. So that is the idea. And definitely the guidelines have also shown, and we have data, that is 2 blood pressure lowering medications should be started together, and it helps. If needed, we can give 3 together as well if 2 are not sufficient. And that decision, of course, lies with your doctor. Another important thing is the late night blood pressure monitoring. So that is also important. Late night blood pressure monitoring and late night medicines have become important. We should give medicines late at night so that the blood pressure in the night does not go high. So we call them non-dippers, whose blood pressures are higher at night. So we don't want them to be high at night. So monitoring the blood pressure, giving 2 molecules at a time in a single pill, and also giving blood pressure medicine, one at the morning and one at the evening, definitely helps. So finally, my message is that you should control your blood pressure. You should monitor it regularly. You go to your doctor, get it consulted. If your blood pressure is high, whether you need lifestyle modification or medicines, you need to adhere by it. And finally, you should not neglect if your blood pressure is high or if you're having any symptom. Please get it checked. Please adhere to therapy. Blood pressure is a killer. It is really dangerous. It harms many of our organs. But if it is under control, it's very fine. Consult your doctor, get it checked, get it treated, live happily. Thank you.